Okie dokie class, we are off to chapter 10, Hematology. In your book it says the Hematologic System, but same concept. Remember, for medical terminology, hema, blood, logi, study of blood. So characteristics, diagnosis, and treatment of disorders affecting erythrocytes, leukocytes, neoplastic disease, cessation of bleeding. So let's start off with disorders of erythrocytes, and that's going to be anemia. So that's a condition of a reduced number of blood cells, red blood cells, produced by erythrocytes, resulting in decreased ability to deliver oxygen to cells and tissues. Now, the etiology, you can get hemorrhage, excessive destruction of red blood cells, nutritional deficiency, or chronic disease can also cause anemia. What are some symptoms that you might see in a patient? Due to tissue hypoxia, you might get a lack of oxygen, fatigue, decreased tolerance to exercise, dyspnea, palpitations, pallor, jaundice, and enlargement of the spleen occurs with anemia caused by hemolysis or red blood cell death. Cardiac signs include tachycardia, rapid heartbeat, and heart murmurs. So I put symptoms on here, but you know that fatigue would be a symptom, decreased tolerance, but signs would be jaundice, tachycardia. Remember, anything objective is a sign that we can measure, and then anything that's subjective, such as fatigue, would be a symptom. Now, what are some treatments for anemia? There's 3 underlying causes, so they can be an iron deficiency, sometimes a B12 deficiency, or a folic acid deficiency. So these can all cause anemia. The number one cause is iron. Usually what they'll do is they'll give ferrous sulfate, but what they found in research is that it's very difficult for the body to absorb ferrous sulfate. So another opportunity or an alternative would be ferrous gluconate, and that seems to be easier to absorb in the body, taken with a glass of orange juice. Now with orange juice, you're going to get your folic acid, which is going to be great, and then you're going to get vitamin C with orange juice, but you also get your iron with that. So for anyone that's anemic, combination of ferrous gluconate with some kind of vitamin C seems to work. All right, and then you can have pernicious anemia, which we'll talk about, but that's usually due to B12 deficiency. So taking ferrous gluconate and B12 seems to be a good combination. Now, how does the PTA deal with somebody with anemia? Exercise for any person with anemia should be approved by a physician. Diminished exercise tolerance is expected. Pacing and training that distribute the intensity of the workload can be used to promote physiological recovery. Exercise should be initiated with extreme caution and should proceed gradually to tolerance and RPE. Decreased oxygen delivery to the skin results in impaired healing and decreased elasticity. If anemia is due to vitamin B12 deficiency, the nervous system will be affected, so paresthesias, gait disturbances, extreme weakness, spasticity, abnormal reflexes. You should always monitor their vital signs. Tachycardia may be the first change observed, accomplished by fatigue, generalized weakness, loss of stamina, and exertional dyspnea, DOE. SPP, systolic blood pressure, may be affected, but diastolic blood pressure may be lower than normal. So these are all some things that you should be aware of when you're monitoring vital signs on a patient that is anemic. Now, what are some disorders of leukocytes? Leukocytes would be what? Yes, white blood cells. Neutropenia is a reduction in circulating neutrophils, white blood cells, which increases the risk of bacterial and fungal infections. Signs and symptoms: chronic infections, fever, skin inflammation, liver abscesses, septicemia, infection in the blood. So when you do your CBC or your blood, usually you'll have the CBC count and look for hemoglobin, hematocrit. But if you have an increased number in neutrophils, that could say, hey, you might have a bacterial infection. Now, white blood cells, 5 major types of white blood cells. You have basophils, eosinophils, lymphocytes, monocytes, neutrophils. The way I remember the acronym is never let monkeys eat bananas. I don't know if you remember that from anatomy, but if you put never is neutrophils, never let lymphocytes, let monkeys, monocytes, eat eosinophils and basophils, bananas. So it goes from the most abundant neutrophils to the least abundant basophils. Okay. Abnormal results, low count, a low number of white blood cells is called leukopenia. May be due to bone marrow deficiency or failure, cancer-treating drugs, certain autoimmune disorders such as lupus, diseases of the liver or spleen, radiation treatment, certain viral illnesses, cancers that damage the bone marrow, severe bacterial infections, and HIV. Abnormal results. What about if you have a high count of white blood cells? High number of white blood cells is called leukocytosis. And that might be due to anemia, cigarette smoking, infections, leukemia. Drugs that might lower your white blood cell count include antibiotics, anticonvulsants, antithyroid. Right. Drugs that might increase your white blood cell counts, corticosteroids, epinephrine, heparin, and lithium. Now, I'm not going to go too much in detail. I don't need you to memorize this whole list of which drugs may lower or increase. But this is just something that you can have as reference and say, okay, these are some things that might affect my patient. Okay. Now, how do you treat neutropenia? It depends upon the cause and severity. Some mild cases resolve without treatment. Severe cases require hospitalization with isolation IV antibiotics. Growth factors, called colony-stimulating factors, which stimulate the production of white blood cells, are especially helpful for patients who develop neutropenia secondary to cancer treatment. What about sickle cell anemia? Sickle cell anemia, a genetically transmitted disorder marked by severe hemolytic anemia, episodes of painful crisis, and increased susceptibility to infections. Approximately 10% of African Americans have sickle cell trait or are heterozygous for the disorder. Those with disease are homozygous or have inherited 2 genes, one from each parent. Sickle cell anemia, red blood cells contain an abnormal form of hemoglobin, causing red blood cells to assume a sickle shape. They're inflexible and very rigid, so you can see that could be a problem going through tiny little blood vessels. They cause obstruction of small arterioles and capillaries, leading to pain and ischemia. More fragile than normal, leading to hemolysis. Thus, patients with sickle cell anemia suffer from hemolytic anemia. Tissue death secondary to ischemia causes painful crises that progress to organ failure with repeated occlusive episodes. Unfortunately, sickle cell anemia cannot be cured. Treatment is aimed at preventing crises, controlling anemia, relieving painful symptoms with narcotic analgesics, blood transfusions and fluid replacements, expand blood volume and oxygen needed for reperfusion of occluded vessels. So, basically, there's no cure, but you can treat it. Okay. Now, so another thing that we would have to take into consideration is hemophilia. And hemophilia A, hemorrhage, bursting forth with blood. So a hemophiliac would be someone that you'd have to be very careful with. Most common inherited bleeding disorder involving factor VIII, primarily affecting the males. In mild to moderate forms, bleeding usually does not occur unless there's a local lesion or trauma, example surgery or dental procedures, may not be detected in childhood. In severe hemophilia, bleeding usually occurs in childhood and is spontaneous and severe, occurring up to several times each month. Hemophilia A, bleeding often occurs in the GI tract and joints in the hip, the knee, the elbow, and the ankle. Causes inflammation with acute pain and swelling. Without proper treatment, causes joint fibrosis that can progress to major disability. Intracranial hemorrhage is an important cause of death in severe hemophilia. How do you treat it? Well, you replace factor VIII chronically. Mild hemophilia can be treated with synthetic hormone desmopressin, which stimulates the release of the carrier for factor VIII. So you can have synthetic, or you can have another hormone, so indirectly. What do you as a PTA have to be careful with? Well, hemophilia, obviously excessive bleeding, but a regular exercise program, including appropriate sports activities, resistance training, cardiovascular aerobic training, and therapeutic strengthening and stretching exercises for affected extremities is an important part of the comprehensive care. A clinician can help individuals with hemophilia identify, seek out, and enjoy physical activity, exercise, and sports participation that provide benefits that outweigh the risk. The other thing with someone with hemophilia is when you're doing passive range of motion or doing that, make sure that you're not really gripping them real tight because you can cause internal bleeding, and make sure using the gait belt, because if they fall, then we have other secondary complications as well. All right, so here is hemophilia bleeding episode, acute hemoarthrosis, muscle hemorrhage, GI involvement, and CNS involvement. What would you see as far as signs and symptoms of acute hemoarthrosis? Aura, tingling, prickling sensation, stiffening into the position of comfort, usually flexion, decreased range of motion, swelling, protective muscle spasms. What if they have a muscle hemorrhage, gradually intensifying pain, they have a protective spasm of the muscle, loss of sensation, the muscle assumes a position of comfort, so a shortened position. What if they have GI involvement, abdominal pain, distension, blood in the stool, vomiting blood, fever? So anytime they have blood coming out of the GI tract or the oral cavity, we've got to be very careful. What if they have CNS involvement? They're going to have impaired judgment, short-term memory deficits, inappropriate behavior, motor deficits such as spasticity, ataxia, abnormal gait, decreased balance, loss of coordination. All right, that was chapter 10. Hopefully that helped.